I thought someone was saying something, but it looks like the Lieutenant Governor has joined us.
I have indeed.
Welcome.
Thank you. It's good to be back.
Lieutenant Governor, thank you very much for joining us. You have 157 as of now and growing county commissioners and mayors and council members ready for your update. And we just mentioned to them that we provided you questions yesterday about the gubernatorial extension of the directive as well as the special session. So with that, let's talk about the nice quiet week we have in front of us.
Well, thank you, Cam and Brandy and everybody else who's on the call. It's great to be back with you again this week. There's several things that we wanted to chat about, and then we definitely want to get to the questions. Hopefully you've seen the numbers for today. So some good news is that our number of positive tests has leveled off and started to drop off a little bit, which is good. The bad news is our testing has dropped off significantly, and that's something we're desperately trying to change. We want more people to get tested. Unfortunately, it turns out just changing the parameters doesn't make it necessarily happen. And so we're working very hard over the last 2 days to get that information pushed down. For those of you on this call, it's important to know that you can now get tested for any one of 6 symptoms. And those 6 symptoms, the first 3, which have been the 3 from the very beginning: a fever, a cough, or tightness, breathing, a hard time breathing. Those 3 things have always been part of it. It used to be you had to have all 3 of those to get tested. That was a couple of weeks ago. And it became you could get tested for any one of those. We've added 3 more symptoms to that: sore throat, muscle pains or aches, and or the loss of smell or taste. Those are the new 3 that have been added. So any 3 of those, she should be allowed to get tested. Now, unfortunately, people are still presenting with symptoms and being told by their doctors or at clinics that they unless they have more symptoms or more severe symptoms, they don't need to get tested, and that's wrong. We're working with the hospital association and many others, the medical association in the state, to get that message out that that's not true. We do need people to get tested, and we need to figure out who has the virus and who they've been in contact with. And so that's really an important thing. A couple others I wanted to bring up since our last since the last time we had a chance to talk. So some of you know that the governor put into place as part of his directive the ask that people who are coming into our state would fill out a very simple form electronically that would let us know if they'd had any symptoms, would allow us to refer them to testing if they are coming into the state, or also notify us if they had tested positive. That is working very well at the airport. People are basically, as they're deplaning, they're just handed a card with a QR code that allows them to go on and fill out that questionnaire. Did not work as well on the borders for a couple reasons. One, I thought, I pushed to have trucking companies exempt from that request, and that did not happen when it went out on Friday. It did on Saturday. We got that fixed on Saturday, so the truckers were exempt from that. And the second piece was the idea of using a geofence, and basically what the idea was that people would just get a text on their phone as they passed across the border into the state of Utah. While the technocrats told us that would be very easy to do, turns out it's not so easy to do. And in fact, what was happening is they were using the alert system, which is a more intrusive type, and you've heard that before. Those of us that were in Salt Lake yesterday heard it here, in that it kind of buzzes your phone. It's more of the Amber Alert type system. And 2, the geofence, while good in theory, and it, by the way, this does not track your phone at all. It just sends a message as you come through that system. Unfortunately, the spillover was far larger, and some of our cell companies just weren't as good at doing this as they said they would be. And so we had people in Vernal and people in Washington County who were getting these updates multiple times throughout the day, and it was just untenable. And so that was withdrawn, yes, on Monday, and the right call, and I'm grateful that was able to be done. I want to talk a little bit about schools. As many of you saw today, the governor working very closely with the state superintendent and the state school board announced that we will just finish out the year as we are right now without having kids go back to school. Two things that does not portray that we are expecting to keep the state shut down longer than expected at all. In fact, we'll talk more about this as we get into the questions. We actually believe that sooner we will be starting to open some things back up in the state, and that's really, really good news because the numbers have been so good and people have been doing just incredible work. What we won't see come back for a while are mass gatherings, and schools count as those mass gatherings. The data is still really, really clear on this, that there is explosive growth anytime you get groups of people together in a room for significant amounts of time. We saw it, there was a funeral in Georgia where over 100 people were infected at a funeral. There was a choir in Washington state where everyone was asymptomatic. They washed their hands. They actually had some distance. They went in, and 60 people in that choir, 40 of them got infected. 2 of them have passed away, and there are several on life support right now. We've seen it here in our long-term care. We had one long-term care facility where there were 30 residents and one person, a worker who was asymptomatic, came in there, absolutely no symptoms, 20 people impacted, 5 or 6 of them have died. The worst thing for this is having large groups of people together in a small area, and it's just not something we could do with schools. Now, there are other things that we will be able to start doing, hopefully very soon, and this week, and we can talk about more about this with the questions on what that next phase looks like, and some of the changes that will happen. We're not going to be able to go back to normal overnight. That's definitely going to take some time, and we're going to need some medical advancements before we get there. But there definitely are some good things that we can do, and that Utah should be one of the first states. We're still one of only eight states that does not have a statewide shelter-in-place order, and we've been able to work very closely with our local health departments and others. And so those are a couple important things I did want to mention. The governor's directive was extended through May 1st. That's at the request of the president, and looking at our data, it matches what the federal response has been through the end of April, and we are reevaluating that every day. But again, the great news is that our hospitalization rates, our mortality rates, our infection rates, our positive testing rates, everything is trending in the right direction, except for the amount of people getting tested, and that's trending in the wrong direction. We're hoping that will change over the next day or two. So hopefully that's a helpful update. Cam and Brandy, we'll turn it to you, and we can jump into some questions.
Perfect. Thank you, Lieutenant Governor. Let's start with the question of the Utah Leads Together plan. There is a 2.0 version of that plan that's going to be coming out soon, and within that plan you have 3 phases. You have the urgent phase, you have the stabilization phase, and you have the recovery phase. We're currently in the urgent phase. So in light of the good news that we saw last week that's continued into this week, what can you share with the folks on the call about the projected timing of the urgent phase and the projected timing of the stabilization phase?
Sure. So when we, if you look at that document, and as you mentioned, it is being updated, we're excited. I know that the governor was just briefed. In fact, he may be still in the briefing right now on the first draft of that that 2.0 document. When we released that document, again using the best data that we had, we believed that the urgent phase would last 8 to 12 weeks. That's what we were being told. As we looked at some other countries, that was the kind of the projections that we were on. Certainly what we were seeing out of New York early on and Washington, that was looking like the 8 weeks would be the best case scenario, and 12 weeks would be kind of the standard, what the medical professionals were telling us. Looking at some of the modeling that we're seeing right now, we actually, and by the way, that was 4 weeks ago. So we're about 4 weeks into phase one of that document of the urgent phase. We actually believe that that there's a possibility that we can get ahead of even the best case scenario there, which was 8 weeks. I hate to put a time frame on this because again, we're watching this every day and it's being refined right now. But I do think it's very possible in the next couple weeks that we will start to open and see some kind of move into that stabilization phase. We're working on some metrics right now, what that looks like as we start to kind of reverse open the things that have been closed. So, for example, when we allow dining in restaurants, there will need to be some spacing. So we won't be just cramming people for the same reasons that I mentioned before. And we're working with every industry right now to look at what those standards look like as we move from a red into a kind of an orange and then a yellow and then green, just completely back to normal. What do those three phases look like? I do think it's possible over the next 2 weeks that we will start to see some of that. One area where I think we'll probably see it first is, and we're having these discussions right now, is to start to allow some, not all, but some more surgeries, some medical procedures to happen. That could happen within the next couple days if we can get broad agreement amongst everyone. There are still two issues. Hospital beds actually look really, really good right now. That's not the problem. PPE is still a problem, and it's something we're working through, so we can't burn through that, or we'll put our healthcare workers at risk. And then there's a huge shortage in the drug that is used. There's an anesthesia, general anesthesia drug that is used, and it's the same drug you use when you intubate someone or put them on a ventilator. And I think it's like only produced in Sweden or someplace, and there's just huge shortages of that right now in the country. And there's several other drugs that would make it so we can't go back to full to full surgeries for everything. But there are some things with local anesthesia that could be open, and we're getting that list together right now. So we're really hopeful that we can start to see some of these things moving in the opposite direction very, very soon.
Thank you, Lieutenant Governor. For our members, as they consider what they need to be preparing for to move to the stabilization phase, which sounds like it may happen sooner than what we may have otherwise thought, can you give us some suggestions of what they may be preparing for? You talk about maybe some measures that should be in place, such as sanitation efforts and otherwise. Can you please talk a little bit more about that and what they could be doing now to prepare to move in?
Yeah. So we will want to, and part of what they're working on now is to give some guidance again for different industries, and that would include government. But I don't think any of it will come as a surprise. Because again, what we desperately want to do is prevent just opening things back up and then spiking and having to close things back down again. That would be the worst case scenario. And so what we're hoping to do is, what are the low risk things that we can do to still prevent the spread, and get some of this activity moving back. And so the things that you'll see are, again, this is going to be part of our new reality as we learn to live with this virus until we get a vaccine. And that is things like wearing masks in public. That's going to be really important. And just the CDC guidance on this is pretty clear. We're just talking about a cloth mask. They can be made at home, and they can just be washed as you would normally wash. Have a couple, and for when you go out. I've been doing this now. When I go to the grocery store, I've been wearing a mask. We don't want people taking up the N95 masks that are needed for healthcare workers, but that's one thing that I think is going to be important. Can we implement distancing with whatever that activity is? Can you still keep people 6 feet apart? That's going to be really important as we open things back up. And making sure that we have the ability for people to wash their hands, that we're cleaning surfaces that are used frequently. The other piece of this that I think will be really important, and one that we would encourage, but by the way, the private sector is going to figure a lot of this out, and they already are, and that's the beauty of this. We don't need to tell everybody what to do in every situation. We've tried to avoid that here in the state of Utah, but what you don't want to do again is to infect all of your workers or your customers, because that's going to shut your business down. And so being able to have some sort of screening process as people come in, like we've been doing here in our emergency operations center. If that's fever testing, just asking if you have any symptoms. If you are, stay at home. Continuing to allow people to work from home whenever possible is going to be important for as long as we can possibly do that. Anything that slows down the spread of this virus is going to be important. And then ultimately, what we're really working toward is mass testing, so that we'll be able to test people as they come back to work, and antibody testing, so we know who's had it before. Is it more widespread than we thought? That may be the case. There are some indicators that it is. We have lots of people who are asymptomatic who may have already had the disease. Do they have the antibodies? And we're working with ARUP, who announced that they are starting the preliminary antibody testing here in Utah. It's going to be focused on frontline workers first, but what in a best case scenario, what we would have is we would have a finger prick serology test at home that tells you if you've already had it before, and then a 2-minute test that we can take that is very quick to see if people have symptoms, and keep them home if they don't have symptoms, and keep them isolated, and the people they've come in contact isolated with. But those are the measures that you should be looking for over the next couple weeks as we look towards starting to open those pieces of the economy.
Perfect. Thank you, Lieutenant Governor. So that everybody on the call knows, Brandy and I represent the Association of Counties and League of Cities and Towns on the Governor's Economic Recovery Task Force. We spend every Monday morning with the Lieutenant Governor, the Governor, and the rest of that team. We also have been working on the Utah Leads Together 2.0 plan and some of those best practices. There are going to be some changes in the 2.0 plan, Lieutenant Governor, that I think would be helpful to help people understand some of the terminology to look for. For example, we've used the terminology of urgent, stabilization, and recovery for the last 4 weeks, which, by the way, the fact it's only been 4 weeks is somewhat astounding, because it generally feels a lot longer than 4 weeks. But can you tell us about the color coding, about the public health factors that will also be in the 2.0, and just how that 2.0 plan is going to help be more surgical in the potential public health interventions, which then in turn will help the state and local areas be able to reactivate their economies based on that more nuanced public health data?
Yeah, no, I'm happy to. And unfortunately, I wasn't in the briefing, and so Cam and Brandy, you may have even better information than I do. But basically, so first of all, we have a dashboard that we look at, and it includes several factors, including the hospitalization rate, which is actually a better metric than testing, those that test positive or not, just because. If people get sick enough, they're going to go to the hospital, right? And they may not have been tested, but they will get tested at the hospital. And so we can watch hospitalization rates, and even if nobody was getting tested, we'd be able to see if we had a big problem. And so we're watching that. We're watching the testing rates. we're looking at the rate of spread. We have all of these metrics that we're looking at that will help inform us as to how good of a job we're doing, and is it safe to, ventilators, ICU beds, all of those things. And so in conjunction with that, we've come up with this metric with these different color coded pieces, and red is where we are now in the urgent phase, and that is really, stay home. We need to keep people as far away as possible, and we need to protect our resources. The next phase is the orange phase, and again, there's a better terminology for this, and we'll have that report out to you. But this is where we start those kind of still including social distancing and these measures that I've talked about, but we're allowing important parts of the economy to start to reopen, and then we go from there into the yellow phase, which is a cautionary phase, not fully out there, but still, again, we're definitely on the other side of this curve, and things are trending where we need to be. And then there's the green phase, and that's when we're back and we're just going, and we found medications to prevent mass deaths, or we've gotten a vaccine, and so that's what you'll be seeing through this. But Cam and Brandy, if you please feel free to jump in. I apologize. I don't have my notes. I've got a copy of it somewhere, but it's not right in front of me.
Thank you.
Brandy, your question.
Yeah, well, and this is kind of a follow-up, maybe more of a comment than a question. I really appreciate your clarification about schools, because as we're messaging that we need to be thinking about the next phase, but wait a minute, schools are opening. I think that that's really good information to understand the reasoning why. And as I've thought about that, I've had a few conversations with county commissioners, as well as, Cam, I even received a call from a town this last week talking about, and the question was really relative to funding, but because of county fairs or rodeos, I mean, July is a big deal for the state of Utah, and a lot of activities that happen. And some of those activities happen and they're a means of revenue for our local governments. They coordinate a lot of effort. There's a lot of volunteer effort that goes into those, but it's a means of a revenue source to their budgets. And so as they're currently having conversations, because there is so much that goes into preparing for those events, they're right now having those conversations about what may happen in July and August. And so, like I said, maybe more of a comment than a question. You may not have the answer to that, but I think the clarifying point is the mass gatherings is an issue, and probably still will be around that time frame. But
yeah, so wow, this is where I wish I could see into the future. I'm just a huge believer in the American spirit and the entrepreneurism. Our medical professionals out there, there's so much at stake in this that there's incentives, there's health incentives, there's life incentives, there's financial incentives to figure out how to beat this thing. And if any country can figure it out, it's us. I really do believe that. And so I think things are going to look different in July than they in August than they look right now. I will tell you, and I'm going to send a podcast out just because I think it's fascinating. There's a person that I really believe in through all of this, and he's a doctor. His name is Scott Gottlieb. He is with the American Enterprise Institute, AEI, but he's a former commissioner with the FDA. And so he's just brilliant. He's been spot on from the very beginning, through February and March and April. He's one of the people I trust. And he did a podcast a couple days ago. It's about 40 minutes long. We'll send it out to you if people are interested in it, where he talks a little bit about the history of this, talks about China and their response. And then he talks about opening up and what things look like. And what's interesting about what he said is it does look like there may be some seasonality to this, and that the warmer temperatures make it harder for the virus to spread. Now, there's some data on that right now. It's still looking for confirmation. Of course, we'll know more as temperatures warm up. But that's going to help a little bit. His biggest concern is with a rebound, a spike in the fall right now, and we certainly certainly saw that with the Spanish flu in 1918. We saw that here in the state of Utah, that there was this resurgence in the fall when things settle down a little bit. I will say again, just to set expectations, that mass gatherings will be the last thing to come back. It's just we know that. It's the super spreader events where one event we saw it with Mardi Gras down in New Orleans. We saw it in there were some soccer events in Italy that were super spreader events where things just exploded. And because there's a 2-day to 14-day delay in seeing the results of that, it's hard to know what's happened until it's happened. And so I'm not telling anybody to cancel those things in July or August right now. We want to try to hopefully we'll get to a place where we can have those things happen. But I will say, stay vigilant. Let's get those other pieces of the economy ramped up as quickly as we can, and then let's figure out if and when it's the right time to do those types of things.
Perfect. Thank you, Lieutenant Governor. Can we pivot to the special session? Is there anything else on the public health side you want to touch on before we move over to the special session?
No. I think we've hit all the high points, and again, just thanks to all of you. Thanks to our medical professionals. I mean, guys, this is really amazing. In fact, I should show you some of the projections that we had. Some that haven't been shared. We had one from the National Guard that said, if we had done nothing, we would have over 900 people in the hospital right now, and that everything that we've done and the sacrifices that people have made are really working, and we should be very proud of that and grateful. Not come without tremendous cost though, and we recognize those costs, and we're doing everything we can to mitigate those. And again, Utah is better poised than any other state to come out of this on the other end. So happy to move into those other questions.
Perfect. Let's start broad with the special session. Legislature is calling themselves in on Thursday. It'll be a historic session. First time the legislature has used that authority, and it will be a virtual session, which means no committee hearings. All of the debate will occur on the floor. And by the floor, I should say the virtual floor, because they will be participating remotely. We know that there has been some tension between the governor's office and the legislature. There's been some tension between the legislature and local health departments and local elected officials. So what can you tell us right now about where the executive branch is at on some of these issues that would be helpful for city and county leaders to know before Thursday?
Well, there's never any tension at all. Yeah, we have amazing legislators, and they're doing tremendous work, and we've been working very closely with them, very closely with legislative leadership. We don't always see things the same way, but we do see things often in a similar way, I guess. And so we're watching the session very closely. We've talked to leadership about several of the bills. I think there's 21, which seems like a lot, but that's okay. I told all of you not to vote for that change in the Constitution that allowed them to do this, but here we are. No, we're going to get through this. What I would say is we have some concerns, and ultimately it will depend on what the draft of the bills look like. And I know some of them have dropped today. We've got our attorney looking at those. I have not had a chance to dive into any of those bills yet. That tension between kind of executive or elected representation versus our local health departments is something that exists. The governor, we had a conversation today, and he's cautious, understanding the concerns about decision making. We also there's a reason that the decisions have been left to health departments in the past instead of making them political decisions, because sometimes the political decisions aren't the right decisions. but sometimes the health decisions aren't aren't as sure as they could be, and there is a public policy piece to this. We've been very fortunate. We've had some bumps along the road, but we've been able to work very closely with our local health authorities, and they've just been fantastic through all of this. I think it's important to realize that this is a once in a 100-year event. And Dr. Gottlieb talks about that. We do have pandemics. We've had them since since the meridian of time. Even before that, there's evidence of pandemics going back to like 400 BC, and so these do occur, and they do occur every 100 years. And I think we'll want to be careful not to overreact to a once in a 100-year event, and realize that hindsight is 2020. It's really easy to sit on our couches and make these decisions. It's a lot harder when you're in the middle of it, and we're faced with these what really are life or death decisions, and we're taking in the best information that we can. And so we're hopeful that we can come to a place where we understand that politicians have their role to play, local health has their role to play, that we should be communicating closely and helping to make informed decisions together, but not completely swing the pendulum so far that we're left in a situation that could be worse off for people in the long run. Sorry, that doesn't mean to be a political answer. It's just I haven't seen the exact language, but we do share some of those concerns, I guess is what I would say.
Lieutenant Governor, I have seen some draft language today, and we appreciate that perspective and agree with you that this is a pandemic. It's a rare occurrence. Let's not overreact. Let's figure out maybe where there could be some better coordination, some collaboration, but let's not overreact to local authority issues and create unintended consequences for so many other situations that we deal with more regularly than maybe what is actually realized.
Yeah, and Brandy, to your point, we believe in local control. I've been a mayor and I've been a county commissioner, and I served as the chair of our local health department, and so we have that experience, and often we're as politicians, we're all about local control, and that's unless the locals do something that we disagree with, and then suddenly we're not big believers in local control anymore, and that's frustrating too. And so I appreciate the frustration that we're seeing, and I do believe that coordination piece is probably the most important, and would have solved some of the bumps that we had along the road. But I'm as guilty as anyone. We weren't communicating with you all as we should have been early on, and I know we had some county commissioners that were frustrated with that, and it wasn't a conscious decision not to communicate. It was that we had a million other things going on, and people pulling at us, and when you're in the thick of that, it's kind of hard to see when you're not experiencing that yourself. And you're right that at the local level, when we've had measles outbreaks and other things that don't even register sometimes, and people don't realize what you all have to deal with every day. And so we're gonna have to really educate our elected officials, our legislators over the next couple of days to help them get it right. And we're gonna need your help with that, because they listen to you. They really do. Sometimes more than they listen to us.
Thank you for that. The next question was just relative to the special session in general. We've talked about the health authority, but I know that there are other pieces dealing with, and I feel like there's actually been good response to some of the issues that we've raised, and I'm appreciative of that, such as the 3-day deposit requirement, maybe extending that to 5 days, and some restrictions on fund balance limitations and otherwise. Are there other things that you would like to highlight that you're aware of, or issues relative to our membership that you would like to discuss?
Well, what I would encourage is, if you have not yet seen the call, that you should go back and read what all we're looking at that is being proposed. There are some important pieces in there, but I agree. Again, most of the things on this call are things that you all or we have asked for, that are really important, and we're going to be working closely with them to get those done. There are a few. One of those is a liability piece that I think we're going to that we're very supportive of, making sure that with a novel virus like this and people trying to do the very best that they can, that we're not opening our healthcare providers or first responders or cities and counties, many of which are the first responders, and so making sure that we don't have liability issues there. So I think that's one thing that's going to be important. We will be looking at the state's capacity to issue bonds, and I think we will see a very robust response. We've been asking for it to help supplement what's happening at the federal level. Look, we've got to keep these businesses open so that when we are able to open things back up, that people have jobs to go back to. Our recovery will be quicker if those businesses are still open. If the businesses have closed, then it becomes very, very difficult, and the recovery becomes much slower. That being said, I will just say as an aside that we all need to be very just eyes wide open on this recovery. This is not just a Utah thing. It doesn't matter how well prepared we are, or how robust we're able to jump back in when the rest of the country and the rest of the nation is behind us and slowing things down. And so it's going to be a tough few months and probably a tough year, and heading into next year. And so I would encourage everyone to relook at your budget. That's the other big piece of this. In fact, this is the biggest piece. That's what we can't do, the legislature can, is look at budgets. And where we thought we had money, we're telling our people right now, even though we had a new budget approved with additional spending for next year, to just don't plan on any of that right now, because we know it's not going to be there. So as a baseline, take last year's budget, and then we'll be looking at ways to cut back, because we know we're going to have to do that. And so if you have discretionary spending that you can slow down on right now, that's something I would also recommend. But those are the big things that will be coming out of this session, and hopefully that's helpful.
Thank you, Lieutenant Governor. And one thing that I'll add, just for your awareness, the league hosted a virtual town hall yesterday. We had almost 300 people from across the state on that town hall as we talked about the budgetary best practices and fiscal impacts of COVID-19. We had Julia Tennant from the University of Utah's Kempsey Gardner Institute provide the data that she has. And ultimately, the message we tried to get across is there's a lot that we know, but there's even more that we don't know yet when it comes to the economic impact of COVID-19. And for everyone on the call, just know that the League and UAC are both working closely with economists, the Tax Commission, and others, because the state's in the same boat, trying to get information as quickly as possible so that we can project and do our budgets.
I should have known you'd be way ahead of me on that, Cam. Well done.
Well, UAC's been doing it as well, because the questions are coming nonstop as people are trying to get on top of it. And we do have a handful of asks for this week around some potential budget flexibility, around potentially the tentative dates for when a budget is approved, and other things, to try to build in as much flexibility as possible so that cities can adjust. Unfortunately, the state and cities are in the same boat right now, because we're in our budget cycle for next year, whereas the counties are in the middle of their budget, and that comes with its own consequences, right, Brandy, of being in the middle of your budget. The one other thing I'll just add for folks on the call is that the resolution came out, the legislative resolution about the CARES Act. It'll create the legal framework to accept the money. And this is a tribute, I think, to state leaders and the special thoughts in Utah. The resolution specifically says that the legislature and the governor intend to work with local government in distributing the CARES Act dollars. And that's not necessarily the case in other states around the country. So, Lieutenant Governor, thank you for that.
Yeah, that was an important addition. We wanted to make sure that was in there. We're all in this together.
Perfect. How much more time do you have?
I've got about 5 more minutes.
Okay, so a couple more questions. I've got a question that is not related to the special session, but it goes back to the public health recommendations that you were mentioning earlier, and that was around the wearing of masks in public. Is there any guidance that either you can give or where you could point people, maybe on the coronavirus.utah.gov website, about the type of masks that people should be wearing, whether how to reuse masks, and then by extension, if you have any guidance about how aggressive the state will be in distributing the finger prick test that you mentioned during your earlier comments.
Yeah, thank you. So the guidance we would give would be the CDC guidance, and I think that's on our website at coronavirus.utah.gov. If not, it's definitely on the CDC's website, and it talks about the types of masks. You can learn how to make one yourself. Again, it can be as simple as a bandana, and I think it's important to point out why. Now, these masks are not necessarily to protect you from getting the disease, but they are to prevent you from spreading it, and it's spread mostly through droplets. We know that, and those droplets come from your saliva, from your mouth as you talk or cough or sneeze. And so anything that stops that from happening is going to slow the spread of this to other people. And so while, again, maybe not protecting you, but if all of us are wearing masks, then that's not getting out, and then we're all protecting each other. And so that's why it's so important, again, until we have a vaccine, that more of us are wearing masks out in public. And that will be one of the recommendations that comes out of this. And so we again, it's not real high tech or real complicated, but it is important. And sorry, what was the second part of that?
The second part was about the finger prick tests and
yes.
what the plan is to
to
distribute the finger prick tests so that they can be utilized particularly by first responders and health providers.
Yeah, so we are we're still working. That test has to be mass produced and sent out. And once it does, we'll be. Our plan is to be pretty aggressive with getting that out. We haven't worked through what that would look like, and again, I still think that that's several weeks away, unfortunately. But when it comes, we're going to want to use that to figure out who has had the disease, and there's several reasons for that. One, it helps us kind of model what the next wave might look like, but two, and more importantly, and why I think all of us would like to know if we've had it is because if you do have those antibodies and it looks like there is some immunity to this disease, then that kind of frees you up to do your thing and not to have to take some of these precautions that others are taking, and will definitely help us to get the economy back and to move us closer to herd immunity or whatever that looks like. So we have been the most aggressive state when it comes to testing from the very beginning. It's our mantra. We appointed a testing czar early on into this, someone who could just beat the drum with testing, who could break down walls, who could work through supply chain issues, who could get the testing labs working together, who could figure out new ways to innovate and get people tested, and antibody testing is part of that. So people are really tired of me hitting them over the head with testing, but it's really what I care about right now, because it's our way through this. So we're working on it.
Perfect. Thank you, Brandy. Your last question.
Yeah, for clarification, Lieutenant Governor, the issue about the mask, that's a directive, not an order, correct? That was an update in the last directive. That was a question that came up. And then,
correct. Yes, that's correct.
If you haven't noticed, for those of you on the call, Mayor Wilson posted the CDC guidance in the link there in the chat group. So for reference, that is there.
Thank you, Mayor.
Perfect. Then the final question, Lieutenant Governor, for today comes from the chat box here from Mayor Dandoy, referencing the question around the transmission rate and how to explain that in simple terms to the general public.
Yeah, well, I'm a simple guy, so so transmission rate. and you've seen some of these graphs where one person passes it, it's an R, you know, and we're looking for an R of 0. So it's the rate at which it's passed from one person to other people. So if one person infects 3 people, and those 3 people infect 3 more people, that you can see how we get that exponential growth, right? In a matter of a few weeks, we can go from one person having it to 100,000 people having it very quickly. The closer we get to 1, it means that we're not seeing that growth. So a 1-to-1 rate is every person that gets infected infects 1 more person, and that will keep us flat, that line flat, where you're seeing, you know, our hospital rates will remain pretty much the same. The ventilator rates remain the same. People are still getting it. It's not growing, but it's remaining flat. And then if you get an R that's less than 1, that means the disease is actually starting to fizzle out. And the only way to do that is to make sure that if you're infected, you're isolated and don't infect anyone else, and you know that includes family members if we can avoid doing that. And so that's really the best case scenario is when that transmission rate is less than 1. Now if you look at our earliest numbers, and these are still being tweaked behind the scenes a little bit, it's because we don't know, because we can't test everybody. So there's a little bit of an algorithm that goes into this, but looking at our hospitalization rates, it's a good way to know what your transmission is, because you assume that the hospital rate is that a certain percentage of everyone infected goes to the hospital. And we can look at what's happened with other countries and other states, and we can kind of back this data out a little bit. So then we can look at our hospitalization rate and say, okay, well, that must mean that there was this many people infected, even though we haven't tested and found that many people. But that's something we monitor. And so we believe our epidemiologists and our data scientists are telling us that we were, 3 weeks ago, our transmission rate was about 1 to 3. So for every 1 person infected, they were infecting 3 other people, which is really bad. And now it looks like, because of the stay-at-home directive and the way that people have socially distanced and the measures that we've taken, avoiding mass gatherings, it's down to 1 to 1.3, I think was what our number was this morning, or 1.2, which is the best number we've seen as that's been trending down. And so we're very hopeful. If we could get that under 1, that would be the best of all worlds. But 1.2 to 1.3 is pretty flat, and that's good news.
Terrific. Well, it's nice to end a call on good news, and that hasn't always been the case over the last 4 weeks. So, Randy, any final comments?
I just want to say thank you. I know that our membership appreciates the time that you take to address them and provide an opportunity for us to ask questions. So thank you for the time that you commit to us.
Thanks all. Keep up the good work.
Perfect. Thank you, Lieutenant Governor, and the League and UAC will be in touch with you and with the membership about the special session. So buckle up.
Here we go. Good luck, everyone. Thanks.
Thank you.
Thanks. Thanks, everyone.